The title of my session is Go. Now, I'm probably preaching to the choir, so I want to ask how many of you have gone? So, yeah, raise your hands if you've done international, any kind of international medical missions. Okay, that's a lot. Keep your hands raised. Now, anybody has served as a volunteer or served in a ministry here in the United States, now raise your hands. Oh, everybody keep up the. See, I am preaching to the choir. Y'all don't need to hear this. We can go home. We can be gone. Well, these are crazy times we live in, and it reminds me of the words of a very famous novelist who most of you recognize, Charles Dickens. And he wrote a book called A Tale of Two Cities. And that, in his kind of most famous words in that novel, it was the best of times, it was the worst of times. Good job. We're living in some interesting times, no doubt. It seems as if we're lurching from one crisis to the next. I mean, I don't even watch the news anymore. It's just too discouraging. And certainly, as a practicing physician, I recognize we're also in the middle of a healthcare crisis, I believe, in our country. So even though there's a lot of bad news, I believe that there's also good news out there. I'm what you might call an eternal optimist. No matter how bad things are, I tend to see the bright side if I can. Like, what can I do about this? Let's just don't cry and give up. So perhaps the most significant crisis of our lifetimes is what? What was it? You think? COVID, exactly. Very good. COVID. I mean, COVID-19 brought our country and the world to its knees. I mean, it was a crisis, that's for sure. And COVID-19 was first discovered in Wuhan, China. And I've been going to China and working in China for so many years that most of you were not born yet. It was in 1981 that I first visited China, and I've been going back ever since. Now, Dr. Nicholas and INMED work in China as well. So, and I learned today that you speak Chinese. Well, I do too. Well, ni hao, Beijing, Shanghai. I don't speak it very well, too much. But the Chinese language, Mandarin, has always fascinated me because it's built around characters. Now, I call them hieroglyphics. That's not what they don't see them as hieroglyphics. But they're characters. They have a character, like a word like man or home would be one character, a drawing. And sometimes the drawing even matches the kind of the idea behind the word. But when it comes to more complex words or concepts, they have to put characters together, right? I wonder what the longest Chinese word is with characters. You know, that I need to chat GPT that. But there is a word for crisis in Mandarin that consists of two characters. Two thoughts together equal the word crisis. And that term is, and I learned on the way up here, I could see who I ran into. There, thank you. She gave me a quick Chinese lesson. And the word for crisis is wei zi. Did I get close? Wei zi. Now, wei is the character for danger. Zi is the character for opportunity. So crisis means danger, but it means opportunity. So when COVID hit, I had the feeling that it was going to be a public health disaster. And when I see a problem or a crisis, I ask myself, is there anything I can do about it? And I wondered if I should go to New York City and volunteer. April of 2020, when it was at its worst in New York City. It was truly a wait-see moment for me. The city was in crisis. There was danger, of course. In fact, I thought there was a good chance that I would get COVID and maybe not survive. In fact, I created a playlist before I got there of songs, comforting songs, to play if I ever was intubated and on a ventilator, because they say that that's good. You can still register that. So, but there was danger, but there was also opportunity. So I looked in the mirror and I thought, if not me, who? If not now, when? And it was like, I guess I need to go. So I did. Well, the COVID crisis gave me an open door, allowing me to lead a team from Heart to Heart International, the volunteers, to serve there for 2-week rotations. That crisis was actually a spark that helped me create another not-for-profit called Global Care Force. Some of my team are here today, and they had a booth. Some of you probably met them. Today, COVID Care Force, Global Care Force, deploys hundreds of medical volunteers, healthcare professional students, even non-medical, to Ukraine, to the Middle East, and throughout the United States. You see, the COVID crisis provided an opportunity and an open door, which I walked through. Now, while I was in New York, I received a cell phone call, and I generally don't answer cell phone numbers if I don't know who they are. And but as I was driving across, I had flown to New Mexico because while I was in New York, I got a call from the Navajo tribal leader of the Navajo Nation asking me for help. I said, well, let me come out and meet. So I flew, and so I went and met with the tribal council, the tribal leaders, as well as the president of the Navajo Nation, the chief, I guess you might say. They call him president, though. So one evening, so we've been sending volunteers for the Navajo Nation. Hundreds and hundreds of volunteers went, and actually we're still sending volunteers to the Navajos, even today with COVID more manageable. Well, one evening as I was driving across the vast Navajo Nation, it's the largest reservation in the United States, it's huge. I got this call, and the Holy Spirit nudged me and said, answer the phone. I thought, okay, we'll see. I can always hang up. So I answered the phone, and there was a lady on the phone, and she goes, you probably, I don't think you know me, we've not met, but I found your name and number as I was praying, and here's what I need, or I'd like to talk to you about. Now, she was an Air Force officer, but not just any officer. You know, I'm a retired Army colonel. I think, well, that's a pretty good deal. That's pretty big. But she was a general, and not just any general. She was the highest ranking female officer in the United States Air Force. Wow. She was a 4-star general, way outranking me. Now, when she served at the Pentagon, and she was serving there when she called me, she had been volunteering on the weekends at a homeless shelter run by Mother Teresa's group, the Missionaries of Charity. And a chaplain from the Pentagon had given her a copy of a book I had written named The Power of Serving Others. She had read it, and that was years before the COVID crisis, but she had gotten a call early in the COVID crisis from the sisters in Tijuana, Mexico, where Mother Teresa has several different ministries there, including homeless shelters. And she says, the sisters there need oxygen concentrators. And she goes, now, I can get concentrators, but what I can't do is I can't order a helicopter to fly into a sovereign nation without going through a whole bunch of red tape. It's just, I can't do it. It'd take me a long time. Can you help? Well, here was another crisis, another opportunity, another open door. So I said, okay, let me see what I can do. So I flew down there to San Diego, across the border, and went to meet with the sisters of some of those houses. And what I found was that their patients who are already homeless people who are already sick and ill and not healthy were, if they got COVID, it was terrible. And so at that point, that early on, we didn't know what to treat them with. We knew we could give them oxygen, but all the other things, ivermectin, steroids, you know, azithromycin, we didn't know for sure how to treat this. It was a wait-see moment for me. Another crisis, another opportunity, another open door. And today, Global Care Force still sends volunteers, both medical and non-medical, to Tijuana and other places in Mexico. Now, here's the point I'm trying to make. There are crises around the world. There are healthcare crises. Dr. Nicholas, I was in your first session, and you had a tremendous PowerPoint presentation that just reinforced so many needs in the healthcare area around the world. I'll tell you what, there are millions, if not billions, of people on this planet that don't have access to basic healthcare. There are hundreds of thousands, if not millions, of healthcare workers who need and want training and education and mentoring. So this is just a tremendous opportunity. I mean, so many open doors. I saw a slide as I came in here earlier, getting set up, of all the different countries that INMED has relationships with that you can volunteer and work with them to serve somewhere in the world. So the question for me, as I think about the needs in the world, is, well, what am I going to do about it? What's the question for you? What are you going to do about it? The doors of opportunity are going to be different for each of us, the way we respond. They will differ from person to person. Some, like me, see a need and want to organize volunteers to go and serve. Others, like Dr. Nicholas, create world-class organizations like INMED to send volunteers and education and so many other things. So, we're all different. I don't expect people to respond to needs the way I do. In fact, thank the Lord, because if everyone responded the way in my kind of personality, go big or go home, or just attack it, a bunch of us would end up in jail. In fact, I almost did. I almost caused an international incident in Israel. Many years ago, I was headed to the airport to fly home, and as I got out of my taxi, I saw a lady step off a bus, elderly woman, and she fell to the ground. Now, you guys are healthcare professionals, students. What is the diagnosis when an elderly woman steps down on something and falls to the ground? No, well, that could be hip fracture. Got it. Well, she stood up. So I realized, well, she didn't break her hip. This is good. So, but I walked over to her to check her out and saw that her wrist was deformed. One of her wrists were deformed, and I knew, oh, she's got a fractured wrist. So I introduced myself. Her name was Mrs. Nielsen, and I said, Mrs. Nielsen, you got two options here. You can go to the emergency room. And the thing is, though, you'll miss your flight home, which, that creates its own set of problems. Or I can fix you up in a little splint. I've gone to some of these courses at Dr. Nicholas's splint. I knew how to take some cardboard and roll it up. And I said, I can make you a little cardboard splint and get some ice on it. And, you can fly home. It's not going to hurt to wait a day. And then when you can get home, tomorrow you can call your doctor. Well, she decided that's what she wanted to do. So I said, your plane to Boston leaves before mine. So I'll tell you what, I'll go with you, help you check in your luggage, and I'll walk with you through security and we'll go to the gate, and I'll just make sure you get on the plane and everything is okay. So she was happy about that. Well, as we were walking to the security checkpoint, I had this epiphany. What are these screening machines? They're nothing but fancy x-ray machines. Now, wouldn't it be great if I could use this machine to x-ray her wrist? So I asked the guy running the machine, and he was military. I mean, Israel's had security screening way before we ever had. And I said, I want to use your x-ray machine to x-ray her wrist. And he says, no way. We can't do that. And I thought, oh, I don't like to take no for an answer, And so I persisted. And I said, now look, this is an emergency. I'm a doctor. This is an emergency. I need to x-ray her wrist to see if her bones are in the right place. Well, the guy running the machine, he finally relented. I kept pressing him. And so I said to Miss Nielsen, I said, okay, put your hand through the straps in the x-ray machine. Take a big breath. That's what they always say. And so she did. Well, of course, by this time, the narcotics that I'd given her were already working. And so she was very agreeable about anything. So she stuck him in there, and I nodded to the guy and said, okay, shoot. And all of a sudden, he starts shaking his head. I said, what's wrong? He goes, well, it's not working. I said, you mean to tell me that when I get here to use the machine, it broke? He goes, no, the machine is perfectly fine. He said that the object, though, has to be moving on the belt through the machine. So I said to Miss Nielsen, I said, look, we got plan B here. I'm gonna help you up, and you're gonna lay flat on this belt, put both your arms out, and you're gonna go through the machine, and I'm gonna run around to the other side and catch you and help you down. Well, she did. And it worked. We had a beautiful x-ray, not only of her wrist, but of her entire skeleton. And it was for free. And I saw that the bones were in pretty good shape, so I knew that no reduction was necessary. Well, why do I tell you this story? Well, first of all, it's funny. And late afternoon, we need to wake up, I suppose. But it's also an example of working in resource-limited areas of the world. You got to be creative. It may be cardboard for a splint. It may be an x-ray. It may be airport security, a screening device. Well, I would guess the majority of people and of you are not real comfortable with sending patients out to the airport for a security screening or going into war zones to serve. I get it. How one person responds in comparison with another is not about right or wrong. It's about our availability and our willingness to walk through a door of opportunity. During this INMED conference, both with the workshops and the general sessions, the exhibitors that you all visited that are now gone, except for my staff. Throw up there for it. Way to go. You're still here to the bitter end. The question is, with so many opportunities, so many open doors, question is, will you go? Will you take that step? Will you go through that open door? You don't have to know where it's all going to end up, how you're going to even get the money to go. You just take one step at a time. Now, I want to close with a true story of how I learned a very important life lesson many years ago. I learned this lesson from one of the most inspiring women I've ever met, one of the most inspiring people that have ever lived, really. This famous woman was a school teacher. Her name was Agnes. That was her given birth name. Now, when she became a Catholic nun and they take their vows, they choose the name of another saint to take. And so she chose the name Teresa from an earlier Saint Teresa of Lisieux, the little flower. And so you know her, of course, Mother Teresa, now Saint Teresa of Calcutta. Mother Teresa had a great impact on my life. About 10 years before she died, I started traveling to Calcutta to volunteer. And I remember the first time I went, I literally showed up at the door of the mother house and knocked on the door, and the sisters opened the door in their white saris, blue trim. You've all seen them in the images. And I said, I'm a doctor from the United States, and I've come here to volunteer. Again, I was thinking, yeah, I had a stethoscope around my neck too, just to make sure they understood. And well, the sisters were very nice, and they said, come on in and wait here, and we'll come and get you and introduce you to Mother. Everybody called her Mother. She called me Doctor. So in a few minutes, they took me upstairs to an area where she came out, and I said, again, I'm a doctor. I'm here to volunteer. I'll do whatever you need. Send me wherever you want to go. And she said, okay, that's wonderful. Yes, we can use you. And she goes, I need to do something, but I'll be back in a minute. Well, she came back, she stepped into a little office and then came back with a folded note. And she gave me the note and she says, I want you to go to the home of the dying. Like it's a hospice for homeless people. Well, that's how she started her ministry. I went, yes. She could have sent me to an orphanage to play with babies. Like, nothing wrong with that. I'm just saying for me, I hadn't come halfway around the world to take care of babies. I wanted to do something significant. So she says, I want you to go to the home for the dying, take this note, and give it to Sister Priscilla. She's in charge. So I got a rickshaw and headed across Calcutta to the home for the dying. I got there and Sister Priscilla came out and I gave her the note. She read it and smiled. And I thought, that should have been my first clue. Something's up here with this note. Does Mother always do this? And I think now that it's all over, I'm pretty sure I know what the note said. Mother saw in me an arrogant, figure, person, doctor, who thought it was really important. And so, I didn't get to read the note. And so Sister Priscilla said, well, wonderful, welcome. Yes, we have work for you to do. Please follow me. So I follow Sister Priscilla. We go right into the men's ward. Men's ward is a room maybe about this big down here on the floor, not quite as wide. On each side are cots, and in the middle a row of cots of emaciated, cachectic, dying men. And I thought, okay, we're going to start here. I'm going to start making rounds and see what we can do. But we didn't stop. We went into the women's ward. I thought, well, now this is really good. These nuns, it's women first. Yes. So I thought, okay, we're going to start here. Well, we didn't stop in the women's ward. We went into the kitchen, and they're cooking rice and beans over an open fire. And I thought, wow, these sisters are so nice. They're going to feed me lunch before I start working. Well, guess what? We didn't stop in the kitchen. We went out the back door into an alley. Sister Priscilla says, see this pile of garbage here? It was huge. And there were 2 buckets and a shovel. She said, we would like you to take this garbage to the city dump. Now, it's just down this alley, go 2 or 3 blocks. You can't miss it. And so, this is what we want you to do. And I thought to myself, holy cow, this is crazy. I mean, these nuns, you've heard you think of biblical stewardship. Were they being good stewards of me, a doctor? There were young college kids in there and others volunteering. They could have been hauling garbage. But I thought, well, I'm here. She asked me to do it, and I'm going to do it. But I wasn't happy about it. I didn't have a very good attitude about it. I mean, the people just watching this foreigner back and forth, carrying this putrefying garbage to the dump with a stethoscope around his neck. You know, I could just leave it hanging somewhere, it'd disappear. Well, I finished the job, and it was late afternoon, so it was all the volunteers were going home. And so I decided, well, I should be courteous and at least say goodbye to Sister Priscilla. So I waited, went through the kitchen, went through the women's ward, went through the men's ward, and I came out to the little opening, or the little area there in the front of the home for the dying, and waited on Sister Priscilla. And as I stood there, I was looking around the walls, and of course, in most Catholic institutions, there's a crucifix. But as I scanned the walls, I saw a poster. So I walked up closer, and I saw that it was a hand-painted poster that someone had made with a quote, the words of Mother Teresa. And when I read those words, I'll tell you what, it was like an arrow piercing my heart. I thought, oh my goodness, this is why I've come halfway around the world. I needed to learn this lesson. I needed this. And these were the words of Mother Teresa. And you've heard them. We can do no great things, only small things with great love. Amen. We can do no great things, only small things with great love. Amen. Well, I had thought serving was all about me, about what I had to offer, about my skills and abilities. You know, I could not imagine that I would ever carry garbage. I mean, what in the world? But I realized that serving others is not about how important I am or indispensable I am or how talented I am. That's not the issue. You know, what's important is the attitude of the heart. An attitude that says, I'm here. I see you. I hear you. I feel your pain, your distress. I want to do what I can to help you. Whether you're a doctor or a garbage man is not the issue. The issue is, are you willing to give whatever you have for those in need? One of my favorite quotes is from Martin Luther King Jr. One of his quotes that stuck with me is a time when he was preaching about all people acknowledging God's call in their life to serve humanity, to serve your community the best you can, no matter your skill level. And he said this, if God calls you to be a street sweeper, be the best street sweeper you can be, so that all the hosts of heaven will declare, there lived a great street sweeper. You see, it's not about being a doctor or a street sweeper. It's about our availability to serve. The most powerful tool you have in your disposal will not be your stethoscopes, your diagnostic equipment, your surgical skills, although those are very important. But as I look back over my career in medicine, the moments I'm most proud of are the little things. Walking through the halls of the hospital and seeing a housekeeper or a maintenance man who I didn't know their names, but I saw them every day, somewhere in the hospital. Just learning their names and acknowledging them and valuing them. Or like standing in front of a pile of garbage and saying, okay, this is what I need to do. This is what they need. I'll do it. When it's all said and done, serving your patient is not the big thing. It's not the great things. It's the small things that you can do with great love. When you do that, you change the world. Literally, every one of you will change the world, one person at a time. Yes. So remember, we can do no great things, only small things with great love. So I ask you, I challenge you, I beg of you, go. Just go. Take that first step. Walk through that open door. Talk to the INMED staff to learn about more opportunities to serve around the world. The world needs you. The world is waiting for you. So, go. Well, thank you for letting me share, and God bless you.